More South Dakotans who had COVID-19 have died, according to the latest update from the State Health Department.
One of the people who died was in their 30s. Health officials also reported just more than 500 new cases, and there are currently 244 coronavirus patients in South Dakota hospitals.
Meanwhile, the CDC has announced new COVID-19 quarantine guidelines for people exposed and infected with the virus. Now, we talked with an Avera doctor about the recent changes. The new CDC guidelines shorten the amount of time you have to quarantine from 10 days to just 5 days. What doctors have learned over the last few months is that people are most contagious 2 days before the first symptoms and 3 days after. Also, fully vaccinated people tend to be less infectious for a longer period of time. And so the new guidelines are being adjusted to fit the science.
What that means from a healthcare system standpoint is that we can get staff back to work faster. And staffing is already an issue that we're dealing with on a daily basis throughout the health system.
Dr. Chaturi says other industries might be able to pull back a bit during a COVID outbreak and keep people at home. And they can't do that in healthcare.
As medical professionals, I mean, we continue to have to deal with not only COVID, but all of the other things that people have on a regular basis. So it's still dealing with strokes and heart attacks and cancer treatments and all of the screening things that we do in primary care. Just to keep people going and keep people healthy.
The new guidelines give healthcare facilities the flexibility to bring people back sooner if they are symptom-free. Before healthcare workers can return, they have to test negative for the virus and be symptom-free. So obviously, if they're not feeling well and day 5 rolls around, they will not come back to work. Turi says because healthcare workers strictly follow safety guidelines at work, like wearing masks and washing hands and being tested, very few healthcare workers get sick at work.
What we notice within our healthcare and talking with employee health and stuff, by and large, most of the exposures and employees that get COVID are getting that outside of the healthcare facility and other just general interactions within the community.
Now, the CDC also recommends people who are infected with COVID and end their quarantine after 5 days wear a mask for another 5 days when they are around other people.